If you're receiving Social Security, SSI, or SSDI benefits, you need to know about the increased payments heading your way in the coming weeks and months. We're talking about substantial increases that could put up to $2,000 or more in additional money into your account this year. And I'm going to break down exactly what you can expect and when to expect it. Stay with me because this information could directly impact your next deposit. The reason I wanted to get this information to you right away is because we're seeing some of the most significant changes to Social Security benefits we've experienced in recent years. The Social Security Administration has implemented a 2.5% cost of living adjustment for 2025, which affects more than 72.5 million Americans receiving Social Security benefits and supplemental security income payments. This isn't just a small bump. For many seniors, this represents hundreds of dollars in additional monthly income throughout the year. And when you add it all up, we're looking at substantial increases that can reach $2,000 or more annually, depending on your current benefit amount. Let me explain exactly how this works for different types of benefits. If you're receiving Social Security retirement benefits, your monthly payment has increased by 2.5% starting in January 2025. For someone receiving the average Social Security retirement benefit, this translates to an additional $48 per month, which equals nearly $580 extra per year. However, if you're receiving higher benefit amounts, your annual increase could easily exceed $1,000, and for couples receiving benefits, the combined household increase can approach or exceed $2,000 annually. For those of you receiving supplemental security income, or SSI, the increases are equally significant. SSI is a federal program that provides monthly payments to people with limited income and resources who are disabled, blind, or age 65 and older. The maximum SSI payment has increased to reflect the 2.5% cost of living adjustment. What makes this particularly important for SSI recipients is that many of you are living on fixed incomes where every dollar matters. And this increase helps maintain your purchasing power as living costs continue to rise. SSDI recipients, those receiving Social Security disability insurance, are also seeing these same percentage increases applied to their monthly benefits. SSDI provides benefits to people who have worked and paid Social Security taxes but can no longer work due to a qualifying disability. The 2.5% increase applies to all SSDI payments, meaning if you're currently receiving $1,500 per month in SSDI benefits, you're looking at an additional $37. Now, let's talk about timing because this is crucial information for planning your finances. The increased Social Security retirement and SSDI payments began in January 2025, but SSI recipients actually started receiving their increased payments on December 31, 2024. This is because SSI payments are typically made on the first of the month, but when the first falls on a weekend or holiday, payments are made on the last business day of the previous month. Understanding your payment schedule is essential for financial planning. Social Security retirement and SSDI benefits are paid on different days of the month depending on when you first became eligible for benefits and your birth date. If you began receiving benefits before May 1997, you receive your payment on the 3rd of each month. If you started receiving benefits after May 1997, your payment date depends on your birth date. Payments are made on the second Wednesday if you were born between the 1st and 10th of the month, the third Wednesday if born between the 11th and 20th, and the fourth Wednesday if born between the 21st and 31st. I want to address something that causes confusion for many people: Medicare premiums and how they affect your Social Security benefits. Medicare Part B premiums are automatically deducted from most people's Social Security benefits. For 2025, the standard Medicare Part B premium is $185 per month, which represents an increase from the previous year. This means that while your Social Security benefit increased by 2.8%, 5%, the actual amount you receive after Medicare premiums are deducted might be less than the full cost of living adjustment. However, federal law includes a hold harmless provision that generally prevents your net Social Security payment from decreasing due to Medicare premium increases. So you're protected from seeing your actual deposit amount go down. Let me also talk about VA benefits, which many of our viewers receive in addition to Social Security. Veterans' compensation and pension benefits also receive annual cost of living adjustments, though these are calculated separately from Social Security increases. If you're a veteran receiving both VA disability compensation and Social Security benefits, you're benefiting from increases in both programs, which can result in substantial additional annual income when combined. For those of you managing both Social Security and SSI benefits, which is possible in certain circumstances, you're receiving increases in both programs. However, it's important to understand that SSI payments may be reduced based on other income you receive, including Social Security benefits. The Social Security Administration automatically coordinates these benefits, but if you have questions about how your specific situation is handled, I encourage you to contact your local Social Security office or create an account at ssa.gov to review your benefit details online. Here's something important that many people don't realize. These cost of living adjustments are automatic, meaning you don't need to apply for them or take any action to receive the increased payments. The Social Security Administration calculates these increases based on the Consumer Price Index for urban wage earners and clerical workers, which measures changes in the cost of goods and services. When this index shows that living costs have increased, Social Security benefits are adjusted accordingly to help maintain your purchasing power. I want to share some practical advice about managing these increased payments. First, review your annual Social Security statement, which shows your complete benefit history and projected future benefits. You can access this through your My Social Security account at ssa.gov. Second, if you're not already signed up for direct deposit, I strongly encourage you to do so. Direct deposit ensures you receive your payments on time without worrying about mail delays, and it provides better security for your funds. If you're planning for retirement or helping a family member navigate these benefits, understanding the full scope of available programs is crucial. Social Security retirement benefits are just one piece of the puzzle. Medicare provides health insurance coverage for people 65 and older, and Medicare Part A is generally free for people who have worked and paid Social Security taxes for at least 10 years. Medicare Parts B and D have monthly premiums, but there are programs available to help lower-income individuals pay these costs. For those of you facing financial challenges, don't forget about other assistance programs that work alongside Social Security and Medicare. The Supplemental Nutrition Assistance Program, commonly called SNAP or food stamps, can help with grocery costs. Many states offer additional assistance programs for utilities, housing, and prescription medications. Your local Area Agency on Aging can provide information about resources available in your community. I know many of you have questions about your specific situations, and I love reading your comments to understand what challenges you're facing and what information would be most helpful. Have you noticed the increased payments in your account? Are you receiving multiple types of benefits, and how has that affected your overall financial situation? Share your experiences in the comments below. Your insights help other viewers understand how these programs work in real-world situations. If you're finding this information valuable, please hit that like button to help more seniors find this content. And don't forget to subscribe to stay updated on all the latest changes affecting Social Security, Medicare, VA benefits, and other programs important to seniors. I regularly cover updates about benefit increases, new programs, policy changes, and practical advice for maximizing your benefits. Let me address some action steps you should consider taking after watching this video. First, if you haven't already, create a My Social Security account at ssa.gov. This secure online portal allows you to view your Social Security statement, get benefit verification letters, change your address or direct deposit information, and start or change your Medicare enrollment. Having online access to your account provides convenience and ensures you have the most current information about your benefits. Second, review your Medicare coverage during the annual open enrollment period, which runs from October 15 through December 7 each year. Even if you're satisfied with your current coverage, it's worth reviewing your options because plans change their coverage and costs annually. You might find a plan that better meets your needs or saves you money on premiums or prescription costs. Third, if you're a veteran or the surviving spouse of a veteran, make sure you're receiving all the benefits you're entitled to. VA benefits can provide significant financial support, and many veterans don't realize they qualify for benefits even if they weren't disabled during their military service. Contact your local VA office or visit va.gov to learn about available programs. The increased Social Security, SSI, and SSDI payments represent real money that can make a meaningful difference in your monthly budget and annual financial picture. With the 2.5% cost of living adjustment, many recipients are seeing additional income that adds up to hundreds or even thousands of dollars throughout the year. Remember that these increases are automatic. You don't need to apply or take any action to receive them. Your next steps should include checking your benefit account online at ssa.gov to verify your payment amounts, ensuring your direct deposit information is current, and reviewing your Medicare coverage during the annual enrollment period. If you're a veteran, don't forget to explore VA benefits that might be available to you. I'm committed to keeping you informed about all the changes that affect your benefits and financial security. Make sure you're subscribed to this channel and have notifications turned on so you don't miss important updates. Your financial security matters, and staying informed is one of the best ways to ensure you're receiving all the benefits you've earned.